The fawn response: understanding and healing trauma's pleasing mechanism. Polyvagal theory is a framework developed by Dr. 𝗨 Porges that explains how our nervous system responds to stress and trauma. According to this theory, we have three main neural circuits that regulate our behavior and physiology: the ventral vagal complex, the sympathetic nervous system, and the dorsal vagal complex. The ventral vagal complex is associated with social engagement, emotional regulation, and feelings of safety and connection. The sympathetic nervous system is responsible for the fight or flight response, which prepares us to face or escape a threat. The dorsal vagal complex is linked to the freeze or collapse response, which shuts down our body and mind when we perceive a life-threatening situation. The fawn response is a lesser-known but also common reaction to trauma, especially in cases of childhood abuse or neglect. The term was coined by therapist Pete Walker, who described it as a response to a threat by becoming more appealing to the threat. The fawn response involves reading the social and emotional cues of others to attend to and care for their needs, often at the expense of one's own needs and identity. The fawn response is a way of seeking safety by merging with the wishes, needs, and demands of others. In terms of polyvagal theory, the fawn response can be seen as an over-reliance on the ventral vagal complex or social nervous system for the purpose of appeasing and pleasing others. However, this also involves a simultaneous activation of the sympathetic nervous system and the dorsal vagal complex, which create a state of hyperarousal and dissociation. This means that the person who is fawning is constantly on alert for signs of danger or displeasure from others, and may also feel numb or detached from their own emotions, sensations, and needs. When the fawn response is on, the person may experience a range of physical and psychological symptoms, such as increased heart rate, blood pressure and breathing, muscle tension, trembling or sweating, anxiety, fear, or panic, difficulty saying no, setting boundaries, or expressing opinions, loss of self-esteem, self-worth, or self-confidence, feelings of guilt, shame, or obligation, difficulty trusting oneself or others, chronic fatigue, pain, or illness. The fawn response is a survival strategy that may have helped the person cope with a traumatic situation in the past, but it can also become a maladaptive pattern that interferes with their well-being and relationships in the present. Therefore, it is important to recognize and heal the fawn response with the help of a professional therapist who can provide a safe and supportive environment for the person to explore and process their trauma, reconnect with their own emotions, sensations, and needs, and develop healthy coping skills and boundaries. By 𝗨h𝗱𝗲𝗿𝘀𝗁𝗍𝗏, Knowledge is Power.